we're doing a static posture assessment. The purpose of this assessment is to assess any deviations throughout the posture, something like nice and straight. So as you see, a jaw jump, nose down. You see the knees sort of coming in, sort of planning, feet come inwards as well.
We're going to do the overhead squat today. The purpose is to identify any dysfunctions within the hip, knee and ankle complex. The way we're going to do it, feet shoulder width apart, arms straight up, and just try to do a normal squat as you normally would. Yep, and up. Very well. And we're just going to do it a couple more times as well.
So the next test we'll be completing is the single leg squat. So the purpose of this is to have a look at the hip, knee and ankle complex, also seeing the stability in that leg when you're going down and coming back up, seeing if there's any compensations that are occurring. So you'll begin by choosing your third foot, the other foot behind you, not in front, so behind, hands on your hips, coming down, and then slowly coming back up. Perfect. So we'll repeat that a few times, a good 5 to 10 times, just to see if there's any compensations occurring. So as we can see, the knees coming in. You can see that the foot is flattening from this angle. Continue to breathe. So today we'll be performing the gait test. Now this is a very simple test. It's just walking and hold, and we'll just look at the pockets of your hip, knee and ankle, just to see if there's any movements or different ways that your knees or ankles are moving in. So you have to walk at 10 metres and then walk back. Okay.
So the next test we're going to be assessing is called the rest test. This test sort of assesses the jumping phase and the landing phase of the movement. Actually just sort of jumps or lands. We look for any compensations between the knees and the feet. Actually sort of lands. So just when you're ready, actually sort of jump as high as you can, land for 2 seconds, and jump up again. And just sort of pull your guns and yeah, when you're ready, and we'll sort of assess how you land.
So this test is the tough jump. Basically, all you're going to do is jump up and bring your knees in as fast as you can for 10 seconds continuously, not stopping. We're going to be assessing your hip, knee and ankle complex, looking for any compensation movements such as your knees coming in or your feet coming in as well, if one foot's in front of the other and so on. So we'll be assessing from the front and the sides. So when you're ready, when I say go, you'll have 10 seconds, just jump up, bring those knees up to your chest as fast as you can. Don't stop until the timer runs out, yeah? When you're ready, go. And stop.
Alright, so we're going to do the wall jump assessment. So the purpose of this assessment is to sort of assess your hip, knee and ankle complex as you sort of jump up. It's not a high load tax on the body, so don't go too high, but also just assess how you sort of jump as the arms are overhead. So we're going to have your feet sort of shoulder width apart. Arms overhead, yep. Arms overhead. Now position, so front bend the knees. You sort of jump off.
So today we'll be performing a long jump and hold test. So the purpose of this test is to look at the complex again. So Jessica will be jumping to a certain point to assess what the motion in her knees and see if there's any tightness in any muscles. At the end of the jump, she'll have to hold it for 5 seconds. Now the stabilising part will show us any indications if knees are coming in or how feet are placed on the ground. And this will indicate different muscles are either tight, weak, and yeah, so what you need to do is start here, bend your knees, make sure you're shoulder width apart, bend and jump as far as you can and making sure you stabilise for that 5 seconds. So once you jump, we'll count to 5 and then you can come back up, okay? Yep. So when you're ready, 1, 2, 3, 4, 5. Perfect. So ready, set, go. 1, 2, 3, 4, 5.
Alright, so this is the 180 jump test. Basically, it's going to assess the lower extremity control and through the knee ankle alignment and jump. So in terms of this test, we're going to assess your position for jumping to the other side and looking at where your knees and ankle land as you jump. Do the jump, so face this way. So now we're going to hold for about 2 seconds. We'll have a look around this side and the front and see how your lands alignment to knees. So ready, Georgia? Yeah, so as you can see, her knees and ankles sort of came in a bit. As you can see, a bit of active around the thighs and calf muscles, which you can assess later on.
So today we're going to do the single leg hop and hold. We're going to be assessing your functional movement of your lower limbs, specifically looking at your knees and your ankles. The purpose of this test is, or how we're going to do it, is stand on one foot with your non-jumping foot slightly behind and up off the floor, and you're going to jump forward as far as you can and really hold it at the end so we can get a good look at your knee and ankle. We are looking for any compensation, so we're going to specifically look at your knee and your ankle, see if there's any turning or flattening of the feet. And yeah, whenever you're ready, one foot, jump forward as high as you can and really hold it at the end. Good job. We'll just do it one more time and we're good to go. Whenever you're ready, and go. Hold on.
So today we're performing the cutting movements. Now this is really focusing and looking at the knees and the ankles. So what the main goal of it is to test the agility and how the taking off phase really shows and indicates a problem. So the way you start on the bench like this is, you jump off. As soon as you land, I'll call out a direction and you just sprint in that direction. So if I say left, start going left. So it's really doing that reaction time and agility. So counting down, as soon as you land, making sure you're taking off, okay? 3, 2, 1, left. Good job. Now we'll repeat it again. 3, 2, 1, right. So we really look at Jess's knees and how they were coming in and her ankles. So when we saw Jess coming down, we can tell that her knees were coming in and her ankles were coming in.
So this is going to be a manual muscle test. We're testing the foot and ankle complex, specifically the anterior tibialis muscle. So basically all we do is we're going to position the foot in dorsiflexion and slight inversion. Now I'm going to be applying gradual and increasing force. So we're going to be putting the foot in dorsiflexion and slight inversion. I'm going to be applying pressure, pulling towards me gradually and increasing this pressure. And Georgia, I want you to pull your foot towards you, and we're going to be assessing your strength. So when you're ready, just pull. Now we're looking for any compensation in everting of the foot. And that's it. So we didn't notice any everting of the foot, so we're going to be grading this a 1.
So we'll be doing the manual muscle testing on the posterior tibialis. So the first thing we'll be doing is making the foot is in plantar flexion and inverted a bit, so just like so. And then I'll be pulling, and Ron will just be pulling in on his end. So I'll be pulling my way and he'll be trying to resist that force. So when you're ready, so we'll just be looking for any compensation. So if the toes are flexing or if the foot is everting. So this will give us a good indicator if there's anything wrong. So we'll do it as a gradual increase and I'll just slowly go through it. Perfect. So as we can see, the toes aren't flexing and he's still in that inversion, so he's not inverting in any way, so that's perfect. And relax, perfect. So I'll give that a score of 3 because there was no any compensations, and yeah, perfect.
Correct.
So we've been testing the middle hamstrings. So Jess, I want to have you sort of raise your hip at 90 degrees and have your knee sort of 50 to 70 degrees. The point of this test is sort of to test the strength of the hamstrings, also the medial part of the hamstrings. So the compensations we're looking for is dorsiflexion and sort of hip adduction. That's what we want to avoid. So Jess, I want to have you sort of pull towards you. I want to pull it the opposite way, sort of test the hamstrings muscle, right? So I'm going to put some pressure on your knee. You want to be ready? We'll just put a slight force. As soon as you gradually increase that as we go. Beautiful, awesome. So we can see that the hip was nice and aligned with the knee, and there was no compensation with the ankle, so it was good.
So this manual muscle test that we're doing today is going to test the biceps femoris. This is going to be a very simple test. We're going to put the leg in hip flexion and knee flexion as well of between 50 and 70 degrees, and the foot is going to be in dorsiflexion and slightly inverted. Now what we're looking for is, I'm going to be stabilizing the knee here and I'm going to be pulling at your ankle towards me, and I want you to pull slightly downwards as we are testing the biceps femoris. So when you're ready, I'm going to be applying some pressure and I just want you to pull your way. Yeah. Very good. So any compensations that we'll be looking for here is any movement of the hip flexion or adduction, and any everting or dorsiflexion of the ankle here. But everything is okay. Her knee and her hip are aligned nicely, and we don't see any compensation movements there. So overall, we give this a grading of 3.
So the last manual muscle testing that we are doing is the TFL. So we'll be firstly getting the leg into position. So it's going to be, the hip's going to be internally rotated. The hip, So the last manual muscle testing we're doing is TFL. So getting the leg into position, the hip wants to be in flexion, abducted a bit, and internally rotated. So this is to make sure that the leg is in the correct position, to make sure we're measuring that TFL. The toes, making sure they are inverted. So I'll be applying pressure around the malleolus, pushing downwards, and then he'll be trying to resist that and pulling outwards, okay? So for any compensation, we'll be checking the knee. So if the knee does go into flexion, like so, we'll see that there is a weakness in the muscle. So we'll just try it, and I'll just put the resistance. Alright. So as you can see, there is no knee flexion, so there is no compensation happening. As we can see, he's got a really straight knee. Perfect. Relax. So I'll give this a score of 3 as there was no compensation shown.
So in the inhibition phase, the type of stretches that we can do include SMR stretches or self-myofascial release exercises. We usually use a tool such as a foam roller to do this, and it helps to improve range of motion, flexibility, and just muscle movement in general. So the muscles that we'll be targeting for our condition are the lateral gastrocnemius, perineals, biceps femoris, and the TFL. For the lateral gastrocnemius, you would go the full length of the gastrocnemius. So lift both legs up, rolling forward, forward, forward to the end. When you find a sore spot, you will roll very slightly forwards and backwards for 30 to 90 seconds up until you feel a release, and we will do this for all 4 muscles. Georgia, when you're ready, attempt to hold yourself up. You can move your hands to reposition yourself as you go the full length of your gastrocnemius, back and forth. When you feel a sore spot, just hold it there. Found one? Yeah. Now slightly move forwards and backwards over that. We'll do it for about 30 to 30 seconds, just until you get a release, or if you feel any discomfort, it's okay to stop. We don't want it to actually cause an injury. The next one we're doing now is our perineals, which is on the side of our lower leg here. We will begin by rolling over the entire length of the tibia until we find a soft spot, and repeating just how we did for the gastrocnemius. If this is too sore or you can't get enough range of motion, it is okay to put one foot down and roll over it all the way to the end, and doing quick little movements back and forth on where we find a tight spot. The third one we'll be doing is our bicep femoris, which is on our hamstrings. We'll begin just under the knees and up to the hips, doing the full length of the bicep femoris until we find a tight spot, and again just repeating. Moving forwards and backwards, and when you find a tight spot, just hover above it, move slightly backwards and forwards, and we'll do this for about 30 to 40 seconds.
If a person can do that with no compensation, compensation means toe strength, knee lift, knee grip.
So this assessment is going to be static stretching. Basically, it's going to involve holding a stretch for a certain muscle between 20 to 30 seconds. It's a great way to relieve muscle soreness, muscle tightness. The first one I want to do is the gastrocnemius. It's actually around your calf. So start off, just going to have your hands on the wall, shoulder height. Now, front foot being foot away from the wall, and the calf line stretch is going to be behind us. So we want to keep the leg nice extended, nice straight. From that stretch, I want you to sort of lean forward, or keep the back leg straight, and just sort of go as far as you can comfortably until you feel a stretch in the calf. Alright, so next one's going to be the soleus. So just like the gastroc, I'm going to involve the same maneuver. This one I'm going to have the knee bent. So have your hands on the wall, shoulder height. Have the front foot about a foot away from the wall. The back leg now extended, keeping it straight. Then the knee bent slightly. Same again, just sort of move forward as far as you can until you feel a nice stretch on the side of the calf. So next one's going to be the biceps femoris, which is part of the hamstring muscle. So just one hand, you do this, lay supine on the floor, just like so. Now, position, just sort of, until we take your hip, then get up. Have your right hand on the back of your knee, just sort of pull as far as you can until you feel a nice stretch in your hamstring. Hold for 20 seconds. Alright, so the last stretch is going to be the TFL, which is the muscle just below the hip. Shown on the video example, you're supposed to do it standing, but they don't really do well, so they don't do compensation or what's the modification. So just want to have you do a lunge on the ground, have your knees 90 degrees. So left foot forward, have your right femur internally rotated, and sort of drop to the right side. Bring your arm above your head. And just sort of drop your hip to the right. You should feel a nice stretch just below your hip, the TFL.
So the next part of the lengthening phase, which is our final phase, is the neuromuscular stretching. So the main muscle we're looking at is the gutterphalanx. So the main part of doing this stretching is to help lengthen the muscle to its full capacity, and it's one of the easiest ways to make it more effective alongside the other things that we've done. So with the gutterphalanx, that's the muscle behind the calf. So I'll be holding and putting a slight resistance and pushing forward, and each time, so we'll hold it for about 7 to 10 seconds, I'll release, and then we'll try and get that range of motion a little bit longer. So by the end of it, we should get a pretty fair range of motion out of it. So I'm going to start, so making sure all flat on the ground, fully extended, make sure the knees aren't bent, because we really want to work in the calves. So I'm going to start. Beautiful, and relax. So I'm going to try and go a little bit more in this time. And relax. So when they're relaxing, making sure they relax fully, so then when you're coming back into that position, you're getting that. So you can already tell he's come a lot in compared to what he has before. I'm going to go again. Beautiful, and relax. So just knee stays down. As soon as you see that knee come up, we know there's some more tightness. And final one. And relax. Perfect. So the last one we'll be doing is for the bicep femoris. So we'll be doing the same technique of holding and releasing and then contracting a bit more. So with this one, we'll be lifting his leg and flexing his hip. So it's up, and he'll be going across his body. So I'll be standing on this side, I'll be pushing the force down at his ankle, and then relax and come back. So making sure that knee is fully extended, try not to get a bent knee in there, because that will really help stretch when it's fully extended, okay? So I'm going to start. How are you feeling?
Good.
Good?
Yeah.
Perfect. So just to make sure you're checking in with the client, because this could be quite painful, because if you do see that they are with facial expressions in quite a bit of pain, you want to stop and try and bring it in, okay? Okay, so we're going. again. So towards the end I started to see that his legs started to shake a little bit, so he was struggling a little bit, but once he continued to do this exercise and also help with the other activation at the start to help get the muscle going, that will assist over time and help lengthen it.
So the first of the isolated strengthening exercises that we're going to be doing are called tail scrunches. So the aim is basically to scrunch the entire tail onto your foot. You start at the start, scrunch and pull the tail forward, and then you do it more little by little until you get to the end. The aim is to be strengthening some of the smaller muscles around the leg and the toes as well. And we'll switch legs as well. So whenever you're ready. As you get stronger and as we go along in the program, we will be adding some weight at the tail as well, just to really get those muscles working and active. The next isolated strengthening exercise we'll be doing is on the anterior tibialis. So we have our weighted machine here, we've got the cable. Basically, Georgia, all you're going to do is dorsiflex your foot forwards and then down, forwards and down. Again, we will be doing 1 to 2 sets of 10 to 15 reps. Now, on your way up, I want you at the end of your contraction to hold for about 2 seconds. And as you're flexing downwards, I want you to take about 4 seconds on your way down, just to really keep the anterior tibialis contracted and active as long as we can. As we go along, we can increase the weight as well. That will really, as progression goes, it will more work your muscles and really get some strength in them. The next muscle we'll be testing is the posterior tibialis. So we have Georgia lying on her side with the weight on her as well. The foot should be dorsiflexed just around like this, and basically all you have to do is invert your foot up and towards you, like so, pulling at the weight. Tell me if you feel it. You should be able to feel it right here in your posterior tibialis. The next muscle that we'll be targeting is the medial gastrocnemius, or the calf muscle. All we're going to be doing is we're going to be going up on this step, holding for any support. Want your heel out and off of the step. All we're going to be doing is contracting up on our toes and then back down. We're doing 1 to 2 sets, 10 to 15 reps, depending on how you feel. When you're ready, we can see here that she is contracting her muscle on her way up. Really defined, nicely contracted, really getting it activated there. Good job.
Now we're looking at the posterior tibialis. So this is one muscle that really indicates if it's weak, flattening feet, and this is what we're trying to see. Okay. So we'll be looking at this muscle just here. So the aim of this is to see if there's weakness or anything going on in this area. So you'll need to plant a flex and then invert a little bit. So I'll be putting a resistant and you'll need to be pushing forward on my hand. And do 1, 2, 3, 4. Rest. Okay, now we'll do it a little bit harder, so at about 50%, okay? Do I need to just rest? Okay, a little bit harder, so about 75%. rest, and now full 100%. Okay, ready? Perfect.
Alright, Jessica, we're going to do a middle hamstring test. So this is how strong the hamstrings are. So what I'm going to have you do is I'm going to lift your hip 1 degree angle, and we're keeping your knee at a 50 to 70 degree angle. So if you can, Jessica, so lift the ankle. Now I want you to sort of externally rotate her hip, so the hips are coming outwards. There's also tibia, so she sort of, there you go, beautiful. Now, Jessica, I'm going to have you one hand on your knee, and one hand on your ankle. Now I'm going to extend. I want you to sort of resist the actual hamstring. So we'll start by 20%, see how you go. So whenever you're ready. Beautiful. Rest. Now go back to 50%. Awesome. Relax. Now go 75%. Relax. Now go 100%. So as hard as you can. And awesome. That's it.
So we're starting with the integrated dynamic movement now. So this is the balance reach test. So this is analysing the whole leg complex, so the hip, knee and ankle functions. And so this is all pretty much working about balance and single leg and how well the body works with it, and like also your upper body as well. Leg straight, continuing through at all 3 times. So it's 1 to 3 sets and it's 10 to 15 reps. So for this, we'll just start with the 2 sets and we'll see how you go, and we'll just start with the reps of 10 and we can gradually bring that up, okay? So when you're ready, so as we saw, that just didn't have any compensations coming in. There was no hip falling or dropping. The knee was perfect. The one that she was moving kept straight at all times, which is what you need. So our next test that we'll be doing is the step up to balance test. So this will be also just working the balance as well and single leg. So it's important that when you're stepping up, you're making sure you're on that single leg the whole way through. So the way you do this is just like going up a step, lifting up and making sure that knee is in flexion position, and then we're coming back down. Perfect. So again, it's that 1 to 3 sets and 10 to 15 reps. This is really showing us that Jess has really good balance. People tend to struggle with this as it is going up higher. So as she's controlling it really well, showing really good strength in the ankle, no wobbly movements going on. Perfect. The lunge to balance test. So this is a very simple one, no equipment needed. So instead of going up, we're actually working up into the movement. So before we're going up onto the step, now we're starting from low and working our way up. So making sure your leg is at that 90 degree angle and your hip is at that 90 degree angle, starting on the lunge, hands on your hips, and then when you're coming up, flexing at that 90 degree. So it's all at that 90 degree at all 3 spots, okay? So it's at that 1 to 3 sets again, 10 to 15 reps. So we'll do the 2 sets again and then do 10 reps and see how we go from there, okay? So beginning with the lunge. Okay, so the last test we'll be doing is the single leg squat. So we'll be having a weight with this one. So starting, so the leg that you're going to be doing your single leg on, whatever you prefer, have your weight on the opposite hand. Perfect. Now putting your other hand on your hip, for some stability, and then you'll come down, and then bring it up. So make sure you have that slow, nice and controlled movement. Make sure the spine is neutral these will be between 1 to 3 sets and 10 to 15 reps. So we'll just get him to alternate sides, but he performed that really well. There was no compensation in the neck or the shoulders coming forward, so that helped making sure that the body was nice and stable. The ankle, there was no movement coming in or out, so making sure his stability was nice and straight and he could not fall in any way, so that was perfect as well.